Hi, Mr. Smith. My name is Luann Lonergan, and I'll be a registered nurse. I know that they said that you were having some congestion in your upper airways. Yep, okay. Can I see your armband? Very good. And they noted that your pulse oximetry was dropping. So what I would like to do is suction. Is that okay? Good. And so what I want you to do, we're going to establish some rules here. So when you want me to stop, or if you're in pain, put up a 1 or put your finger up, and then I'll know to stop. So I'm going to get some supplies ready first. First thing I like to do, and we'll get going pretty quick here, I'm going to wipe off the table. Very good. I can hear some of that congestion, Mr. Smith, so we're going to get going with that. All right. Then I'm going to wash my hands. And the first thing I like to do is get my supplies all situated. And so some of the things that I'm going to do right now, I'm going to get a suction catheter, and I'm checking the expiration date. Looks good. It's a 10 French suction catheter. And I've got some sodium chloride irrigation, and I'm going to use that, and I'm checking the expiration date. So I'm going to check that bottle 3 times. So I'm going to open this up. All right. And I can set that down, and I'm going to toss this. And I'm going to open it up, and it should tell me what I have. It does. It's a catheter on one side, gloves and basin on the other. So I'm going to open these up, knowing that this is very sterile. And the first thing I see are my gloves are on top, and what I'm going to do is I'm going to just flop this over to get my basin, so I can really get my basin. I'm going to be very careful just to touch the tip of the basin and come off to the side here. And I'm going to open that up. I'm now looking at that for a second time, sodium chloride, and I'm going to look one more time, sodium chloride. And I'm going to hold that in my palm, the label, and I'm going to pour off to the side. There we go. Good. Now what I'd like to do is get on my sterile gloves. I'm going to put on my first sterile glove, so I'm going to pick it up on the cuff with my non-dominant hand, and I'm going to put it on, step back. Very good. Now I'm going to go underneath that cuff, get my 4 fingers. I'm going to step back and put that on. I kind of twisted that a little bit, so that's okay. I can touch all on the outside of that. We're set to go. Now I'm going to take this catheter, I'm going to open, and I'm going to roll that up into my dominant hand. And now what I'm going to do is I'm going to contaminate this hand right now while I get the suction catheter set. I'm going to be very careful, and I'm going to just turn on the suction just to check that. I'm going to turn it to about 80 to 100 millimeters of mercury. Very good. Okay, Mr. Smith, I'm almost ready to go, so I'm going to take off this oxygen here. And now what I want to do is I'm going to come on over here, and I'm going to lubricate this a little bit. Okay, Mr. Smith, I'm going to go down about 5 inches. And he's coughing, coughing, coughing. I'm going to pull back about 1 inch, and now I'm going to rotate as I apply intermittent suction. Beautiful. And I got some of that drainage out. And then I'm going to put on the oxygen and just let him rest a little bit. You doing okay, Mr. Smith? Very good. I still can hear some of that congestion. I'm going to go back down, okay? Okay. So what I'm going to do, I'm going to go down about 5 inches till I hit that bifurcation. I'm going to pull back about 1/2 inch, and now I'm going to apply that suction afterwards, intermittent. Again, I'm going to clear out that tubing, and then I'm going to put that back on here. So we're going to just keep doing, you're doing really good, Mr. Smith. Very good. You doing okay? I'm going to go down one more time. Is that okay? Okay, your breathing is getting slower, so things I don't hear quite as much, but just a little bit. All right, so the same thing. What I'm going to do, I'm going to go down about 5 inches, and there's no suction going down. Now I'm going to pull back. Now I'm going to apply that suction intermittently, rotating that catheter. Then I'm going to clear out that catheter. Very good. Okay, sometimes then we're all done suctioning, and I can go into his oral cavity a little bit, so in his mouth, just a little bit, just to get some things, some debris that might be here. Could also go into the nare a little bit. Or we have something called a tonsil tip suction catheter, and this would be just clean technique, so same thing. I might have to put that up a little bit more. Okay, and then I could suction that out a little bit. Good job. Real good, Mr. Smith. I can bring that through there. Good job. Okay, Mr. Smith, things look real good. So what I would want to do then is just make sure Mr. Smith is doing okay. His color looks better. His breathing looks good. So I'll put the bed down, and again, I'll clean up my supplies, and I'll put the call light within reach.